Nearly 70 years ago, a young Hackettstown businessman named Bill Rossi was involved in an automobile accident and was taken to the nearest hospital located in Newton. During the uncomfortable ride, Rossi commented, "Wouldn't it be nice if we had a hospital here in Hackettstown?" The dream of a hospital for the Hackettstown area emerged in the 1940s, but it wasn't until the 1950s that this idea really took hold. Community efforts for a hospital began when a local group led by local farmer Daniel Allen and businessman Bill Rossi met in 1953. They formed the Hackettstown Hospital Committee, and this group went on to motivate an entire community to work together to help make the dream a reality. After incorporating with Dan Allen as president and 21-member board, the group personally contributed money to purchase the land on which the hospital would be built. In 1967, the Seventh-day Adventist Church was invited to join the effort, and Milton Murray was dispatched to organize and lead the fundraising effort. The hospital's directors increased their original donations to kick off a fundraising campaign. Volunteers were recruited, and headquarters was opened on Main Street. A novel fundraising effort conceived and organized by Bill Rossi and fondly referred to as the Bucket Brigade operated from 1968 until 1972. Volunteers were stationed along Route 46 in Hackettstown with plastic buckets and netted $101,000 from passing motorists. In total, the community raised more than $2.2 million toward the building fund from donations large and small. The official groundbreaking was held in August 1970, and in February 1973, the doors of Hackettstown Community Hospital opened to admit patients. According to hospital records, nearly 5,000 people attended the opening ceremonies, nearly 5 times the number expected. By 1980, it became clear that the hospital had to expand in order to meet increasing demand. As a result, the Hackettstown Community Health Care Foundation was incorporated to serve as the fundraising arm of the hospital. The first major project, the Progress Fund, raised $1 million in just 7 months. The donations were used to help fund the first addition to the young hospital, which housed an expanded emergency room, radiology, laboratory, and other ancillary departments. In the early 80s, the Women's Auxiliary was formed, and throughout the decade, fundraising campaigns helped further the growth of the hospital, including the addition of the first CT scanner and a new intensive care unit. During the 1990s, a new support services wing and medical office building were constructed, and the Childbirth Family Center opened after extensive renovations to the 4th floor. By the end of the 90s, with the help of another fundraising campaign, extensive modernization and renovation work began that would further position the hospital for the 21st century. The most visible evidence that major changes were occurring at the hospital was the dramatic facelift to the exterior of the building. Initially, the eastern, northern, and southern exposures were given a new look, while larger plans lay in store for the west side of the hospital. At the end of 2001, the emergency department was updated and enlarged. In 2003, construction began on the West Wing addition and a second medical office building, the largest expansion project since the hospital was built. The intensive care, coronary care, and progressive care units, diagnostic imaging, cardiopulmonary, and surgical services were expanded and relocated to new space. Simultaneously, a capital campaign began and raised $6.8 million to construct the Joan Neckel Cancer Center and a vascular laboratory. In April 2005, recognizing the hospital's significant facility expansion and growth in technology, services, and medical staff, Hackettstown Community Hospital was renamed Hackettstown Regional Medical Center. Since then, many new services have evolved at HRMC, utilizing the latest technologies and advances in medical treatment. Today, HRMC is a well-respected medical facility, and we continue to evolve to meet the medical needs of our patients in the midst of a rapidly changing healthcare environment. With your continued support, HRMC will be here for many more years to serve patients in this region.